Well, good evening, everybody. I am Darcy Jakopchak, but don't worry, there will not be a test later, so you may call me Darcy. So, I'm going to speak with you a little bit on a few more initiatives that we want you to be aware of, particularly the and in the interest of time, I'm not going to go into all the details. We could be here for hours, but I'm going to try to just summarize the program. I want to review some of the key points about this program and then tell you what resources are available to you for further information and assistance if you want to participate in the EHR incentive program. So this incentive was authorized by the Recovery Act, and it's one of many provisions that taken collectively were called the High-Tech Act, part of the Recovery Act, and they're really all aimed at promoting the widespread adoption of health information technology. Essentially, this provision was designed to provide, I'm awfully loud, aren't I? Are you hearing ringing? Or maybe it's just me, sorry, I'll stand back. Anyway, this provides an incentive to eligible professionals and eligible hospitals for demonstrating meaningful use of electronic health records. So the first question people always ask is, well, what do you really mean when you say meaningful use? That's really the crux of the whole program. The statute spoke to meaningful use in terms of three essential components. It's using certified electronic health records to perform such functions as electronic prescribing. It's using certified electronic health records to share information, exchange information, to improve the quality of care that's provided. And it's also using EHR to submit clinical quality data and other reporting that the Secretary specifies. So that's what the statute had to say about meaningful use. And keeping that in mind, when the implementing regulation was issued, it really outlined five health outcome priorities: improving quality, safety, and efficiency, and reducing health disparities, engaging patients and their families in their healthcare decision-making, improving care coordination among healthcare providers, improving population health, improving public health overall, and of course, very importantly, ensuring adequate privacy and security of personal health information. So the regulation took it further and defined specific objectives and measures required to demonstrate meaningful use in stage 1 of this program. Future rulemaking will address stage 2 of meaningful use and stage 3. But I'll touch more in a minute on some of these meaningful use objectives. But I want to talk very briefly just about eligibility. Who is an eligible professional? And the answer to that question differs depending upon whether you're choosing to participate in Medicare or the Medicaid incentive program. Under Medicare, it was very straightforward. An eligible professional is any individual who is defined in the Medicare law for all other purposes as a physician. So, of course, it's doctors of medicine, osteopathic physicians, dentists, chiropractors, optometrists, and podiatrists. That's who in Medicare law is defined as a physician. Under Medicaid, the definition of eligible professional is a little more expansive in terms of it's MDs, DOs, dentists, and certain non-physician practitioners. So depending on which program you're participating in, the definition of eligible professional is slightly different. The other thing about eligibility I want to mention is an otherwise eligible professional who is hospital-based cannot participate in this program. And the regulation defined hospital-based as one who provides 90% or more of their services in an inpatient or emergency room setting. And the way we determined that for 2011 is that they looked at claims for fiscal year 2010, actually looked at claims data to determine who could and who could not be eligible to participate. So that, in a nutshell, is who is an eligible professional. Now, in terms of meaningful use, as I mentioned, the 2010 regulation addressed stage 1. It sets forth 15 core measures and 10 menu set measures And for an eligible professional, they have to meet the 15 core measures and 5 of the 10, at least 5 of the 10. They can defer 5 of the 10 menu set measures. Otherwise, they must meet all of the other measures unless they qualify for an exclusion. There are several of these criteria that, several of these measures that have exclusion criteria. So sometimes it might be something that, you know, simply wouldn't apply to your practice. Let's say you're a dentist participating in the Medicaid incentive and you don't do immunizations. Well, you're not going to have any data to report. So and also it mentions, of course, clinical quality measures. And those are reported on in the course of reporting on these 15 core and 10 menu set measures. So that's how we gather the information on the clinical quality measures. Our website, and I'll talk a little bit more about the website later, but there's a section of the website that has a specification sheet for every one of these measures. And it's excellent information in terms of defining what is this measure really all about, what are we after, what's the numerator, what's the denominator, are there exclusion criteria that I can meet. And so I would highly recommend that if you have any questions about the specifics, that's where you could look. Reporting through attestation for 2011. Well, if you participate in the Medicare program, you have to meet meaningful use in your first year of participation. Unlike with Medicaid, with the Medicaid program, in your first year of participation, you simply need to adopt, implement, or upgrade your EHR to receive the incentive payment. At the attestation, we will be doing all this reporting via attestation for 2011. For the first year of meaningful use, you simply have to demonstrate meaningful use for a 90-day consecutive period in the reporting year, which is the calendar year. For hospitals, it's federal fiscal year. For professionals, the reporting year is the calendar year. So if 2011 would be your first year, then you have to attest that you met meaningful use, all the criteria, for at least a 90-day period. Another difference between the two programs is the amount of money and the duration of the program. The Medicare program, began January 1st of this year and runs through 2016. You can participate in the Medicaid incentive for up to 5 consecutive years between now and the end of 2016. In order to maximize the value of the program, you must start in 2011 or in 2012. It's kind of a decreasing annual maximum. So if you participated and qualified for the maximum each year in the 5 years, and you started in 2011 or 12, you could receive up to $44,000. Under Medicaid, the program is extending a lot longer. It goes to 2021. You can begin participating as late as 2016. You can participate for 6 years and receive up to $63,750. So again, just some of the difference. Another Medicaid difference is you have to meet Medicaid volume thresholds, which means a certain number of your patients have to be Medicaid patients in order to participate in that program. So for most physicians, that's 30%. If 30% or more of your patients are Medicaid patients, you can participate in that. For pediatricians, it can be as low as 20%. So registration began for this program January 3rd for Medicare and for some of the state Medicaid programs who were ready to launch their programs. And that was about, I think there were 11 states. Now 13 states have launched. Missouri launched their program this month. So it is now possible to register and begin participation in Missouri's program. If you're from Kansas, the Kansas Medicaid folks are still in the process of implementing their program, and they expect to launch it in the fall. So one could still participate for 2011. It's just not up and running yet. So these are just the key dates that I want you to keep in mind regarding this year. Recently, we've had a series of national calls regarding registration and walking through the registration module, because it is an online module through our website. If you missed those, I'm going to be giving you a little information later on. We're having a regional webinar where we will try to do the same thing. has anybody registered for the program? I should just stop and ask. Okay, great. So you can all attest that it really wasn't that bad a deal, right? It works, I guess, if you successfully registered. Okay, we have Exhibit A, Exhibit B here. Okay, so like I said, we're going to be having a regional webinar May 4th. Now, attestation has begun also just this week. That started, attestation was available beginning on Monday, April 18th, for the Medicare program. So anyone who registered and then went in this week and did the attestation that they've already met the 90 days of meaningful use will likely be paid in May if they have reached the maximum allowed charges in order to receive the $18,000. Let me just stop right here and say the way the incentive is calculated under Medicare, it is 75% of your allowed charges for services that are paid under the Medicare physician fee schedule. So if you have more than $24,000 of allowed charges in the year, you're going to get the maximum $18,000 for this year. So it's $18,000 if this year's your first year, $18,000 if 2012 is your first year, and then it decreases over time to $44,000. And then, I mean, you know, to cumulatively reach $44,000. Is there anybody in this room who actually does any practicing in a health professional shortage area? Okay, well then, if you qualify for the max, you also would qualify for a 10% HPSA bonus on top of that. So the maximum for somebody in a health professional shortage area would actually be $48,400 over the life of the program. Okay, so we've talked about the reporting year, and of course they mentioned here October 1st would be the last day that you could begin that 90-day reporting period, because the reporting year is the calendar year. The reporting year ends December 31st. And then, you know, you don't have to have a whole lot of Medicare patients to participate in this. If you're somebody who hasn't reached the $24,000 of allowed charges, we're going to continue to look at claims through February 29th of 2012 and calculate an incentive payment for you based on whatever those allowed charges are. If you reach the $24,000 through the year, you will be issued a check or an electronic funds transfer, whatever applies, as soon as you hit the $24,000. Let's say you registered already, and you can register at any time. You can register, we encourage you to register, even if you're not ready, even if you don't have your certified EHR up and running, even if you haven't achieved meaningful use, you can go in and register. And, you know, as this shows, you can, the last day for you to do that, to register and attest and receive $2,011 is February 29th, 2012.